Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back, everybody, to Healthy Living. A random pain in the middle of your stomach near your belly button that gets increasingly worse is one of the most telling signs that you may have appendicitis. It's when your appendix, which is attached to your large intestine, becomes inflamed, and if not treated, it can actually threaten your life. To help you figure out if the stomach trouble you're feeling is just hopefully gas or constipation or something more serious like appendicitis, the doctor is in, as Dr. Jitka Lom is here. She's in studio to tell us more about this very, very uncomfortable topic. Doctor, welcome back.
Hi, Jason.
Okay, I'm just a modest caveman. I only know what I see basically in movies, but I do know for a fact that the appendicitis, as I understand it, serves absolutely no purpose in the body whatsoever.
I think you're right. Nobody has identified a purpose. It's called what's known as a vestigial organ, meaning it's left over from some remnant in the past. Maybe there was another digestive system it attached to, but for now it's just a little nubbin about the length of your finger that hangs onto your large intestine. Mm-hmm.
And appendicitis, by definition, is when the appendix becomes irritated and inflamed. But I've had friends that were in high school and got appendicitis. I've heard of older people, and colleagues of mine have gotten appendicitis later on in life. Have people in your line of work been able to definitively say exactly what causes it, and is there anything we can take to avoid that? Because it is a very messy situation.
It is. Actually, even children can have appendicitis, so it makes it very difficult. But normally the appendix really doesn't have much inside of it. It's just basically a little piece of intestine that's just there. It's kind of flat, doesn't have much in it. Occasionally some stool or some fecal matter can basically get in there and then be trapped and not be able to get out, and bacteria will start overgrowing and causing inflammation there. Then it starts to hurt and swell. And if you're lucky, it will sort of release the material and settle down by itself, but that's not that common, and most of the time it just continues to hurt and hurt, and if it swells enough, then it will actually rupture, and that is a very serious condition. 50% mortality rate off that if your appendix actually ruptures.
So you got a 1 in 2 shot if your appendix ruptures. And this keep in mind, this is all in the span of a few hours once it starts growing.
It can sort of grumble along over a day or two, but usually within a couple of days you can certainly figure out what's going on with the help of a CT scan or an ultrasound for sure.
And with modern day medicine, even though like with tonsillitis, I should say, like these days, whereas before you'd have to have a procedure and get your tonsils taken out, now you can kind of take antibiotics, or you can take oral medication.
Right.
For the most part, you still have to have surgery to get the appendix out.
Usually, yeah, because nobody wants to run that risk of rupture. So if it's a very elderly person, or sometimes somebody who's quite sickly and it's too high risk to do the surgery, or if it's just kind of brewing along slowly, then surgeons sometimes will do antibiotics, lots of liquids, and bowel rest, meaning no eating or drinking while in the hospital. Don't try this at home. And be monitored, have a CT scan every day, follow it along, and sometimes it'll settle down by itself, and then you can have it removed when it's not inflamed, preventively. Okay,
and now of course, as we mentioned in the lead, maybe what are some self-tests that people can do as far as, like if they're feeling discomfort, how does one know whether it might be gas or constipation, or like maybe even indigestion, or maybe something more serious like appendicitis?
Right. Well, appendicitis is sometimes a difficult diagnosis, but most of the time you'll have a fever along with it, at least a low-grade temperature. You will definitely lose your appetite and not feel like eating, and the pain sort of starts in the middle of the tummy and then starts to kind of tend to go over toward the right-hand side, lower down in the right side of the abdomen. So one thing you can also check and see is, does it feel okay if you're moving around? Like, for example, if you jump up and down, especially with a child, you can ask them to jump up and down. If they can jump up and down and they're doing okay without making the pain very severe, then they're probably all right, because that just tells us that there might be inflammation there, but it's not so severe that it's irritating the whole abdominal cavity. So losing your appetite, fever, and pain in the right lower quadrant, difficulty moving around, those are some signs. So if you have somebody who's got a bad appendicitis, they'll come in like this.
They're keeled over.
They hate even just going over bumps in the car.
Because the appendix is by that point inflamed, will your stomach be distended in any way? Or?
It can be bloated, or it can just be really hard, and then just touching it very lightly causes tremendous amount of pain. That often means that it is actually already ruptured.
Okay, is there anything that if somebody believes they might have appendicitis, of course this isn't something you want to try doing at home, but like again, is there any type of besides, you know, touching that area, any self-test, or like, is there any website you would recommend they read for comparison, maybe?
I think mostly just really getting it checked out. You know, I guess the one thing that you can do is if you have any belly pain, stop eating. Sometimes people will keep eating and your bowels are really telling you to stop. Just drink clear liquids, meaning water or tea or something you can see through, lemonade, okay, but not anything that has any substance, because your guts really need to rest. They're inflamed and they don't need any stimulation right now. Okay. That's a really good rule of thumb. Don't eat. And another thing is, you know, if you did have appendicitis, before surgery, they need you to have not had anything by mouth for about 6 hours before they can administer anesthesia.
Right.
So it'll prolong your surgery if you eat.
And then real quick, if you call 911, is this something that EMTs can typically diagnose? Or?
Not at all.
Okay.
I think they would need to tend to take you to a physician, and even the doctor quite often will not be quite sure. Even very experienced physicians will need the help of imaging, meaning a CT scan or at least an ultrasound.
All right, got it. Well, those are just many of the questions that we have. We have a bunch that came in from online, so sit tight. We got those coming up next, and you stay tuned because Healthy Living Tuesday continues with the topic of appendicitis when we return.